On this episode of Showcase, Peter Landgren and Dr. John Tew Jr. discuss how music therapy techniques are being employed in clinical settings to help people who are living with neurological disorders. You will also learn more about a new Bachelor's of Science degree in music therapy that has been co-designed by the University of Cincinnati College Conservatory of Music and the Xavier University Department of Music and Theater. Stay tuned. Showcase is coming up next.
Hi, I'm Barbara Keller, and welcome to this edition of Showcase. Today, I'm joined by Dr. John Tew, who is a professor of neurosurgery and the executive director of community affairs at the University of Cincinnati Neuroscience Institute, and Peter Landgren, who is the dean of the University of Cincinnati College Conservatory of Music. Welcome to the show, John and Peter.
Good to be here, Barbara.
We're
Thank
so
you,
happy to
Barbara.
have you here because John got me interested in your subject today, and it's something I think all our viewers will be really interested in. And Peter, give us a little background.
Well, the background of really why we're talking today is music therapy. You know, as we know, up the hill at C.C.M, we've got tremendous majors in all of the theatrical arts, musical arts, media arts. In a year and a half, we're going to add another major, which we're very excited about. It's a collaboration between Xavier University and UC, and we're going to start a music therapy program in major. And it's something that's a burgeoning science and therapy in this country. I know John's going to be able to talk about all the things with 5 syllables or less, and I take care of everything else, you know, shorter than that. But it's a very exciting program because this adds a major and a different attitude in the school. These students are healers. They want to, I think all musicians, all creative people want to share their art. But when they're sharing their art to heal someone, I mean, to truly make them feel better, to make them recover from possibly a devastating injury or a birth defect that they will never be able to actually solve, but the music can help them. This is a wonderful major. I'm so excited that we're going to be able to add this to all of the variety that we've got at CCM already.
Well, John, tell us a little bit about your background and your feelings about this program, because you're certainly the guy that everybody knows as far as neurology is concerned in Cincinnati, and you're the expert.
Well, I have a very natural love and appreciation for music, and therefore my tremendous analogy for Peter and what he is able to do. You know, music therapy as an academic field is relatively new. As I recall, Michigan State had the first program back in 1947 or so, and the American Society is only 10 years old. So Peter is on the cusp of bringing something very important to Cincinnati, and what organization is better prepared to do that than our CCM, one of the best organizations of its type teaching and presenting music in the world. But I might say that music therapy is probably the oldest of the arts. It really is. If you look back 1,000 years BC, little David was playing on his harp to King Saul, who was melancholy and depressed, and he had a very effective therapy. And ever since, music has been recognized for its healing effect. Another quick story is the development of the Goldberg variations, you know, that fabulous music done by Bach. Goldberg was a traveling pianist with Count Meyerling from the Russian music theater, and he happened to be passing through Leipzig and asked Bach to develop a piece of music for him because he was very sickly and couldn't sleep. So Bach said, well, we need to have something peaceful and energetic, and it was able to do both. And what a beautiful piece of music that's still played today. But Meyerling wanted it played in the next room so it would help him relax and sleep. So that's being done all over now. The reason it developed so well after World War II is we've recognized the shock, the problems that our returning veterans were having, and what a role music could play in that. And increasingly, music therapy is being applied all across the field of medicine, no more importantly than in disorders like autism, and on the other end of the spectrum with people who are suffering in our nursing homes today with cognitive decline. So there's a tremendous opportunity here for people to be taught how to apply these very important skills that Peter has in his school.
What was there a study that I read about where music therapy was helpful with Alzheimer's?
Oh, absolutely. There's actually a documentary now that's the most impressive one I've seen anywhere. It's called Alive Inside. And the concept is that music is our most basic kind of rhythm. It vibrates and moves inside of every one of us, and as children, that kind of rhythm is instilled into us, and it's in the brain, even in the most primitive part of the brain, and people remember that when they don't remember anything else. And what they learned in this program is you can play, find out what the music was that a particular individual liked, give them an iPad or an iPod and play it back, and they wake up. They wake up, and it alleviates much of their agitation, depression, and helps them to come back to reality. That's just one of the major examples of how we can make our nursing homes and even our homes better places to live and better to accommodating for people who may have cognitive decline.
And John, you know, I was able to witness that actually with my own mother because I lost my mother to Alzheimer's a number of years ago, and after she had lost the ability to speak anymore, she was still able to react facially. And I was walking her through the nursing home, and there was an old-fashioned jukebox playing down in a recreation center, and there was some Glenn Miller on. And Glenn Miller was my parents' generation. That's the music that they danced to when they met. And my mother, I just all of a sudden saw this expression. She started moving. She even tried to mouth some words, but again, she had lost that ability. So music was just touching something that was so far back in her that she remembered it. She was alive. She was back then, and it really truly was therapeutic for her.
Tell our audience a little bit about the new program. Is it going to be a degree in music therapy?
Yes, yeah, because actually what we're talking about is a couple of different things. I think if we all, when we're at dinner time or when we're preparing dinner, if we put music on, sometimes our mood will draw us to one piece of music, another time it'll draw us to another piece of music. And so our psyche is sort of telling us we're programmed this particular way right now. Truly with music therapy, which is a clinically based therapeutic method, the same way physical therapy is, the same way when we go see our MDs for some medicine or something. You know, there's a therapy behind whether someone has autism. So in other words, they will in essence have a series of exercises, musical exercises. They will learn tunes. They will do all sorts of things that our students are taught through a 4-year undergraduate program. And so it will just be another, in essence, music major that's housed within C.C.M. The partnership with Xavier is fantastic because they're going to have some majors come into their college, which is only what, 3 miles away from UC.
Right. A bicycle ride.
Yes, yes, that's right, a very short bicycle ride.
Right.
And we will have some students at our school at CCM. CCM will house all of the music therapy classes themselves because we have the College of Medicine, we have the McMicken College of Arts and Sciences, so we have all of these other resources available to us at the University of Cincinnati. So we'll be able to really fully house this this program within the university. Also, fortunately, guess what, geographically, right in between our two schools, we've got Cincinnati Children's. And Cincinnati Children's has, I wouldn't call them an army, they're a platoon of music therapists already. And they're housed in that children's hospital, and I've already talked with a therapist there and the heads of the hospital. They're very anxious to partner with us.
You know what? One of the reasons why we're so excited about this, Barbara, is because we are building a foundation now of wellness and health, which is the converse of disease management. We're talking about wellness care. And music is such an integral part of that, because using music as a basis for meditation, mindfulness, across the board is so important for not only people who are physically disabled, but particularly mentally disabled. You know, all the problems you have with autism, ADHD. There's a huge opportunity here for this new platform of wellness and healthy living to integrate music into the platform and into the hospital inpatient and outpatient care.
So will the doctoral students, the medical doctoral students, as opposed to Peter's doctoral students, will they be a part of?
Absolutely, absolutely. They're already a part of the new curriculum of wellness and focusing more and more on nutrition, exercise, mindfulness, stress management. Very important part of the overall four-part picture. So we're just so excited that Peter is working with us and know that he comes with such brilliant students.
How did the two of you happen to meld into this great project?
Well, John and I know each other from boards that we sit on in town, and also just up at the university. And so we were chatting one day, and I talked to him about this idea that I had at that point. And truly, it was just an idea. And he's been one of the greatest champions for this program moving forward. I had no idea until I did. But I think it's also it's somewhat in the water that we're drinking up at the university right now, because certainly there's incredible excellence housed in each of the colleges, each of the 14 colleges. What we're doing now, we've got a cadre of deans. John has just been elevated to a new position. I don't know how it all fits on your business card, but we're working a lot more between colleges. We're working across boundaries, and I think it's an exciting time at UC because we're understanding the assets that we each have ourselves, but then the assets that we have across campus, whatever that campus is, so we can partner and we can be, you know, better than ourselves. I mean, the best mathematical equation is 1 + 1 = 3, and I think that's exactly what we've got here.
Well, it makes so much sense. You wonder what took us so long.
Well, but it's curious. CCM, oddly enough, has a history in this already without ever having housed this major. Back when Kathleen Battle was a student here, she had a roommate whose name was DeForia Lane. And DeForia was an opera singer just like Kathleen. And DeForia went out to Europe, had a number of successful contracts and many years singing in European opera. But she came back to the States and felt somehow that there was something missing in her life. I happened to meet DeForia in my last job when I was up in Cleveland. And she's running at the university hospitals their music therapy program there, where they have a dozen music therapists at
Wow.
UH up in Cleveland. And she came back here and said, I feel like I'm helping people in my performances when I'm standing up there singing Tosca or whatever I'm singing, but she wanted to help people more directly, and she found her way to music therapy. There's a music therapist that I've also met in Cincinnati here. I actually found her through social media on LinkedIn, Mimi Sinclair, who I knew when we were C.C.M. students together as Mimi Bryant, and she was a terrific violinist. Spent 10 years in the CSO first violin section, and again, 10 years in, she said, I'm loving this. I love playing in music hall every day, but there's something in my psyche that's not being fulfilled, and she found her way to music therapy. So she's again one of our local partners that we'll be working with, because we have very active internship programs that we have to partner for our students to get these degrees. So you're around here long enough and you start asking enough questions and you find that, well, it's here already, we're just uncovering it.
Yeah, that's why we
We are
ask all the
already
questions.
implementing part of this program even before it's off the ground. The opera, Cincinnati Opera, has a relationship with the university hospital, and every quarter they bring in several young, brilliant singers from the C.C.M. opera program, and they go throughout the hospital serenading patients, visiting,
Yeah.
inpatient, outpatient, and it's been a huge successful program.
Well,
Just-
I can imagine.
Just as the opera outreach program is
Sure.
everywhere.
Right.
Sure, and
Yeah.
and one of the assets that we use in the College of Medicine, and especially Sid Kosla, who's a fellow opera board member, is when we're bringing our music theater students, our opera students, and our drama students to campus, we have their voices scoped to make sure that everything is healthy, because we really want to support their vocal health. And even a drama student who's not singing, their voice is their instrument. And so we have doctors who coach them, we have coaches who coach them. And so we're really combining that medicine and art already in this vocal consortium, and the opera, Cincinnati Opera, has been a great partner through this as well.
Their voices are scoped.
Yes, yes. So,
Yeah.
Meaning what they do is there's you probably can say it better than I. There's an oscilloscope that they check to make sure that everything is healthy and there are no nodes on
Right.
the vocal cords. So they call it scoping.
It's a direct visualization of
Okay.
the anatomy, and
Yeah.
also checking the auditory concept to see
Because
if,
I know the
if
nodes
there's
are a
a-
huge problem with
if
singers. and
there's
they,
Right.
some-
effective projection. But what Peter said was so important here is this platform that goes across the whole system, not just in the medical field, but throughout the whole university. That we're seeing this cooperation, this collaboration come now, so that you're seeing wellness being built as a platform underneath all of the systems, underneath cancer, heart, metabolic, obesity, cardiac. So everybody's recognizing the importance of wellness, and that music is such a big aspect of that.
well, and when you're fighting a disease, I don't know that there's any scientific proof, but certainly being calm is part of the therapy.
And actually, there is scientific proof, because in Cincinnati Children's and other hospitals, they're seeing a reduction in pre-surgical anesthesia, because music therapists go in and play and engage pre-surgical patients in singing and playing, and so they're seeing a reduction in the medication that they have to use.
This is all so incredible, and you two guys are perfect to get together.
I have to put one plug in here for what
Okay.
really happens to your brain. Under the spell of music. It's been documented now by something called fMRI, functional MRI, that the memory area of your brain actually gets thicker, and that connections are improved. So it's this coming together of mindfulness, meditation, influenced by music that not only quiets but actually improves the functional capacity of the brain.
Wow. Well, I think we all knew it, but scientific proof is a great thing.
It's powerful.
Absolutely.
If there
Absolutely,
would
Barbara.
be any naysayers.
Yeah.
You guys are both so fantastic and such a great gift, both of you, to Cincinnati. And I thank you so much for bringing this to my attention
Sure.
Our pleasure.
and coming to share it.
Thank
And
you.
when it gets further along, if there are new things you want to talk about with it, I hope you'll come. And in the meantime, we'll keep providing the music,
That's right.
and you all keep the project going. It sounds great.
Check out Alive Inside.
Okay,
So,
we'll
so special.
right.
Yeah, it is.
We'll try
It
to
is.
get that for our viewers,
Great.
and I think they'll find it as amazing as you do.
Yeah, yeah.
Thank you so much.
It's good talking with you about
Thank
this,
you,
Barbara.
Nice to
Barbara.
see
This
you.
was wonderful.
One of the many things I love about hosting Showcase is when we feature world-class musicians. Today, I wanted to share with you one of my favorite performances from violin virtuoso Tatiana Berman that we taped a couple of years ago. I hope you enjoy it. Wasn't that fabulous? Thanks for watching Showcase. I'm Barbara Keller. Have a great night.
For more information about today's episode, please visit our website at www.cetconnect.org and click on the Showcase icon in the middle of the screen. While you're at our webpage, you can watch this and other episodes of Showcase with Barbara Keller on demand.